Let's take a minute to review the postoperative expectations for hip and knee replacement. There is an easy to remember rule of 1 to 2. This refers to the time points experienced during the recovery, including 1 to 2 hours, days, weeks, months, and years. The surgery itself is expected to take 1 to 2 hours. It is typically a 1 to 2 day process to get home, with the large majority of our patients going home the same day of surgery. Unfortunately, there are 1 to 2 weeks of fairly intense pain, swelling, and limited mobility. In a separate video, we will discuss the specifics of the multimodal pain management regimen we employ. In addition to the medications, it is important to utilize ice, elevation, compression, and short, frequent walks. It typically takes 1 to 2 months to return to normal activities of daily living, such as walking without an assistive device, preparing meals, driving, and starting to return to sports and other hobbies. It takes 1 to 2 years to complete the recovery. During this time, it is expected for the joint, especially after knee surgery, to remain slightly warm and swollen for about a year postoperatively. This can be accompanied with occasional achiness and stiffness. Having said that, most patients feel fairly recovered by about 3 months, including returning to a near normal sleep cycle. Remember, everybody recovers differently. Pain tolerance, scar tissue, swelling, and bruising are different for each individual. I often joke that the grass is greener on the other side, but there's a tall barbed wire fence to jump over. Hopefully we can make scaling that fence as least painful as possible and get you enjoying those greener pastures.